In future medicine, we will have different technologies, and these technologies will help us to improve the quality of life. We will have different, disciplines of science in future medicine. But for today, I would like to have a quick update on 3D by printing technology and its future in the medicine. It's a picture of a prototype of 3D bioprinter in which we can, design different parts of tissues and generate some functional systems based on them. Okay. In this picture, you can see three pictures. In the left one, you can see a lot of medication, some pills, some capsules, some pearls. In the second picture, you can see a lady or gentleman. He or she has some problems in face and in head and neck, maybe some burn or maybe some trauma in this case. And in the right one, you can see a painting, a very famous one from Van Gogh. And if you look at this painting, you can see the right ear is missing. So this painting is suffering from a maybe trauma, and the right ear is missing. So let's go and see how can we help some people based on 3D bioprinting. I would like to bring you some real examples of application, global application of 3D bioprinters. And the first example related to a great research team in UK. It's called the Cleves team. And these team are trying to use 3D bioprinter to generate multi-layered medications in order to help patients who have to take different medications every day in different time points. But using this 3D bioprinting technology, these patients could have a single pill instead of a lot of medications to help them to don't forget this medication. So it could be a potential application of 3D bioprinting in this case. But the next one, it's a real story, and it's related to a patient who had a motorcycle. He was a motorcyclist, and he had an accident in Wales, in UK. And because of this accident, the motorcyclist had some trauma in left side of the face, and some parts of skull and orbital bone, and also maxilla bone was injured, and it was a multiple trauma, and it was a very complicated case for the medical team. You can see here the medical team, the surgeon and the crew who helped this patient. But without using 3D bioprinting, they couldn't help this patient to regenerate the missing bones and also reorganize and reshape different parts of the face after trauma. In this picture, you can see the different protheses and different parts of this prothèse used to facilitate tissue repair and to reorganize this damaged bone to help this patient to regenerate his face. Another example, it's again a real example. You can see two physicians here, Dietmar in Australia and Jan Thorsten in Germany. They could develop a technique to help a kid after skull surgery. In this picture, in the right side, you can see this kid was suffering from some defect in the skull bone after neurosurgery. But using 3D bioprinting, they could help her to regenerate this defect. And you can see here, after implantation of 3D bioprinted replacement for the skull bone, you can see mineralization of this tissue by her own osteoblasts, and you can see here the defected bone is replaced. Again, another real example. It was related to Professor Gillen Edward Green. The real story was related to a 6-week-old boy, a very small baby. He had some serious difficulties in respiration, and when his parents brought him to the hospital, he cannot breathe very well. And Professor Green realized that there is some defect in the trachea, in some branches of trachea. And because of this obstruction in the trachea, this small kid cannot breathe very well. So they use 3D bioprinting and make a rigid stand to use the mechanical properties of this rigid stand to provide enough airflow for this 6-week-old small boy. And after implantation of this rigid stand, the distress in respiration was reduced, and the kid could start a normal respiration, and it was no life-threatening situation anymore. Again, another example, a team you can see here, Professor Glenn Green and also Professor Scott Holster. They are producing some parts of body, for example, ear or nose, which are mostly generated with cartilage tissues, and they would like to use these bioprinted scaffolds and use autologous cells to make real tissues for replacement therapy in these patients. In this picture, I would like to introduce one of the icons in regenerative medicine and one of the leaders of the field in this case. I'm sure most of you know Professor Anthony Atala, who was a pioneer in regenerative medicine and also in tissue bioprinting as well. And in his approach in 3D bioprinting based regenerative medicine, they focus on more complicated organs and systems, and they want to use different kinds of cells, a kind of co-culturing different cells with some mechanical parts to generate real missing parts of the body. Also, another real story and a real scientist in this field in 3D bioprinting is Dr. James Holmes. Mr. Holmes is in medical service for UK Army, and his focus is on skin burn and how can we use 3D bioprinting to replace burnt skin, because burning is the most important pathology for armies, because it's the most common injury during wars, and it's a serious life-threatening challenge for people in the army. So he started an interesting project to use 3D bioprinting in order to replace and regenerate missing parts of the skin after trauma. And I hope and I'm sure we will hear more about this in the future. But we should consider a very important subject in terms of tissue bioprinting. When we start bioprinting different tissues, we face some limitations in the size and in the dimensions of bioprinted tissue. We should consider the fact that bioprinted cells need facilitated oxygen and nutrition. And when we use different layers of bioprinted cells, we may deprive the core and the inner parts of the bioprinted construct from oxygen and nutrient, and it may cause some problems for us. And this is the subject of Dr. Novakovic. She was interested in bioprinting, but she recommended us to use some plumbing system like blood vessels to facilitate circulation of nutrients and oxygen through the bioprinted tissue to help inner layers and cells located in the core of the bioprinted tissue to have access to this oxygen and nutrients. So in the future, we will see more advanced technique using 3D bioprinting, but considering some plumbing devices in order to facilitate oxygen and nutrients access to the internal cells. That was the advanced 3D bioprinting in the future of medicine. I would like to ask you, please look after yourself, because your original tissues and original systems are indispensable. Despite the advancement in regenerative medicine and tissue bioprinting, your original tissues and original systems are very, very nice and very important. Thank you for your attention.